most annoying thing is that sometimes, even when they come and they qualify for admission, their parents will tell you, oh, I didn't know this child will be admitted. I'm not ready for admission.
So?
And you have to fight them, sometimes involve the hospital security before you can.
So they want to take the child back home?
Back home.
Although the child has suffered such burns?
Yes. And the thing is that when burns occur, especially within the first 24 hours, you don't see the severity. If your eyes are not trained, you will not see. Some of them, the skin, this is after days when the skin or the skin has peeled off. So in the initial phases of the burn, when they come, you really have to suffer before they would even allow you to admit their kids.
Now, when you insist and you admit them, at whose expense? Because if the person says, I'm not ready, it means that the person will not financially commit to the treatment of the child. Okay,
so the burns unit, indeed, is one of the units in the hospital where we are always making losses. So the parents, they will pay some bill, but when you look at the totality, the hospital spends or the nation spends on these patients. And most of the time, by the time they get to Konfo-Anokye, they would have been to one or two places, they would have spent money there, they come to Konfo-Anokye, they can't afford the care.
Continuous treatment.
And for us as clinicians, we always have our way of keeping them in. So at the end of the day, you discharge a patient, having spent 6 months in the hospital, you discharge them and they'll spend another 3 months. Sometimes by benevolence, someone will pay for them, or we engage the social workers and then they are allowed to go home.
Listeners, join us on Facebook and get to